All right, as the pandemic goes on, I had to bring the president of the National Black Nurses Association, Dr. Martha A. Dawson. She is going to such a valuable resource because we talk about and salute people on the front lines of the coronavirus pandemic. And there are so many nurses and stories that we're hearing about nurses who are heavily affected. They're on the front lines. They're doing all that they can. They're also risking their lives to save the lives of others. So Dr. Martha A. Dawson, thank you so much for being with us this morning.
You're so welcome, and thank you for having me.
Absolutely. First and foremost, can we dive into the African American community? Because one of the things that I'm noticing in the news is a little bit of confusion when it comes to, are we hitting a curve, but then also the fact that there are more Black people that are being affected and dying from coronavirus than anybody else. So can you speak to the state of African Americans in the coronavirus pandemic?
Okay, yes, I can. First of all, I'd just like to say that we serve the African American communities. We have about 118 chapters in 36 states, and this is not new for us. We have been in the community for 50 years. And it's also not new to us that more African Americans are being affected by this virus, because as you are aware, one of the first things they came out and said is that people with comorbidities, meaning people with multiple healthcare issues, would suffer more from this particular virus. And for years, that has been not only the African American communities, but other communities of color. When you come and begin to talk about cardiovascular disease, which is heart disease, renal disease, which is we call kidney disease, and diabetes, we call sugar, all of those things you're going to find to be more prevalent amongst the African American people. So we have been addressing many of these issues for years, whether we was talking about obesity or whatever. And what is happening is because we have so many comorbidities, once the virus enters our system, we're more likely to have more of a reaction to it, I would put it that way, which means that we're going to get sick easier. And the fact that we may end up on ventilators, and also as we're seeing in the news, we're going to have more deaths. Not in terms of numbers, but in terms of percentages. So we have to pay attention to the percent, because the numbers can be misleading. But when you our hotspots at this time, such as down in New Orleans, Louisiana, where we may only be a small part of the population, but 70% of the deaths are African Americans.
Yeah. Now, Dr. Dawson, now being that you're on the front lines, how does this affect you on a personal level, like dealing with your direct family, when you go home, and anybody that's doing what you're doing?
Okay. At this time, I am not in the practice setting. I'm in academia at this time, but I will say that in terms of just educating my own family members and helping them to understand that this is a serious illness and something they don't want to be exposed to. It's a little hard to explain sometimes to young adults or teenagers or children why you can't go to the park, why you need to be careful about hanging out in a crowd of 10 or 20 or more. So you really have to take time to explain it at their level. And I think that is important. Words matters. And we can't be using words around individuals if they don't understand it. So it's left up to us who are on the front line to break down some of these large medical terminology so that our family members and our communities can really understand what we're saying.
Now, there's a lot of people that are claiming to be donating towards the healthcare workers and stuff like that. And this is millions of dollars. Are you all seeing y'all seeing that money? And if not, where can people go to donate so that it's really getting in the hands of people that need this donation money?
Okay, there are two things. People can donate directly to the National Black Nursing Association, and we will indeed make sure that the money is spent correctly and get to the people on the front line. The other thing is we are working with, at this time, Sandra Eva Manley out of California, who's been a big supporter of the MBNA, and she's asking individuals to donate to her foundation. And if anyone want more information about that, they can always go to our website, nbna.org, or contact our national office, and we can give out that information. We have also been very fortunate that NBNA has a very wide footprint. So many of our corporate partners are working with us to help get supplies to the front line. For example, about 2 weeks ago, we had a pharmaceutical company to contact us, and they wanted to donate some equipment. And so working with our executive director, Dr. Millicent Gorham, we was able to connect them directly with the chief nursing officer at a healthcare facility so that they could actually expedite that contribution. So as much as we can, we try to connect people to those individual at practice sites where patients are being taken care of.
Dr. Dawson, can I ask you about some of these articles that are saying that the nurses are understaffed and they don't have what they need to do their jobs? How is that has anyone from the National Black Nursing Association, are they speaking about that, and what's happening exactly as far as like nurses having what they need and being properly protected in these hospitals?
Okay, I would like to speak on that in two parts. The first part is we have to understand as a nation, we already had a growing nursing shortage in this country anyway. So the fact that just under regular conditions, we was having some staffing issues. So now you begin to multiply that with this pandemic, and you can imagine, yes, we're gonna have some staffing issues. Again, as it relates to supplies being on the front line, I am still hearing from some of our members and also nurses that are not our members, especially in the states where we have the most cases. Yes, they're still saying that they need protective equipment. They still don't have some of the gloves and the gowns and things that they need. And even more importantly, I'm just hearing that some nurses are just tired because they're working long hours. And again, these are our heroes. They're doing what many other people would not do. They're compromising their family time. They're having to guard and protect their families. So when they leave from the hospital and go home, to ensure that they're not infected and taking the virus with them. So they're doing everything that they can. But let's just be real. There's no way we're going to have the number of ventilators, the amount of protective equipment that we need, because this kind of hit us all at one time.
Right.
If we do better, I hope that we can.
Now, Dr. Dawson, real quick, once this is all over, right, what does normal look like to you, from this point on? Like, is this like a bookmark in a period of time where, like, people will remember, well, before Corona, we used to da-da-da-da-da-da-da. Like, will we go back to the way things were pre-Corona when this is all said and done?
I can't speak from the social context, but I will speak from the healthcare space. And what I'm hoping is, because we've had so much conversation in the last 2 to 3 weeks about social determinants and healthcare disparities, well, those things been around for the last 50 or 60 years. What I'm hoping is that when this is over and we start entering the recovery phase, that conversation does not need to end. It needs to pick up speed. Absolutely. And we need to be very, very careful. Someone said, so is there light at the end of the tunnel? This is my analogy. I read somewhere where it said that you have to be very careful that the light that you're looking at, that it is the end and not the next oncoming train. Mm-hmm. And so we, as African-American people, there are some things we have to begin to do. We have to advocate for better health care. Not silently, but with the voice and with the demand. We have to make sure that we have enough for African-American healthcare workers to support our communities and to support our patients. Let me give and share a little statistic with you. In the United States, there are 3.9 million RNs, registered nurses. And there's almost 900 and some thousand LPNs. In some places, they call them LVNs. Out of that 3.9 million RNs, only about 300,000 are African Americans. That's about 7.8%.
Wow.
The state of California have more RNs than we have for the whole nation. They have about 500 RNs in California. So what we want to do as an organization is to take this time and say, let's begin to correct the problems that we have in terms of diversity within healthcare. It's not just with nurses. You're going to find the same thing with whether you're talking about doctors, respiratory therapists, physical therapists, pharmacists, dentists, optometrists. So we need more of our people going into healthcare as a profession.
Turn some of these rappers into nurses is what I'm seeing.
Yes, and if they don't want to do that, they can donate to us, and we will use the money to support nurses that are trying to get an education. Because we need more African American nurses. I mean, we need nurses that look like us, because we're going to be the ones out there talking to our family members and working in our communities. So
Right.
this is important. So I hope at some point you all will invite me back to talk more about the nursing workforce and healthcare determinants, and also health disparities.
We would love to have you.
Absolutely. Well, I have a question for you about, so one thing that they've been saying, and this kind of piggybacks off of Headcrack's question, is that maybe from now on moving forward, we will have to wear masks all the time. Do you see that being something that like is going to happen in the future, that we will always have to have masks on?
History does not support that. And the reason I say history doesn't support that is because this coronavirus is just another part of SARS. You know, a couple of years ago we had that. I was a young nurse at the bedside where HIV and AIDS first came about. People were thinking, well, we're not going to be able to get rid of this. A lot of the safety things that we are using today in healthcare really came about because of some of the prior health issues that we had, such as AIDS, and just when we had, the flu epidemic in this country. If you go back and you think about the smallpox, we have been able to come up to the occasion, find solution, and move forward. There was a time when we had polio in this country. We don't see that worldwide anymore. So I can't say never. I do believe there's a space and a time that we're going to have to continue this. And I say to all of my brothers and sisters out there, all of my uncles and nieces, all of my family members, my friends, and including my enemies, do not allow other people to dictate your health and what you need to do for yourself and your family. So they may open up whatever they want to open up, but if you do not need to be in that space, protect yourself and don't go in that space. At least, even though it's early evidence, we have enough evidence to know that this does not bear well for the African American community. You need to look at those states like New York. You need to look at what is happening in Illinois. You need to look at what is happening down in Florida, California. If you look at the state of Michigan, there is, as of yesterday, there was 29,000 plus cases, and they had 2,000 and about 93 deaths. Only 14% of that state population is African American. Yet still in Detroit alone, just one city where there's the majority Black, there's been 7,383 cases. That's 25% of the whole state, just in one city. And there's been 546 deaths. That's 26% of the deaths. So we have to protect our own. We have to look at the data. We have to teach each other. And we have to say, listen, if we have to shelter in just a little longer, let's shelter in.
On behalf of all the nurses, Dr. Dawson, what message would you want to get to the general public from the nurses who are on the front lines right now?
There are some things that we need. We need for you to talk to your political leaders, your healthcare departments, at the local level, at the state level, and at the federal level. We need for you all to be advocating for our nurses on the front line. Remember, they have family members, they have children, they have mothers, and they have fathers. There is information out there talking about how the healthcare profession has been impacted by this virus. I think out of the national deaths that have taken place, about 17% of those have been healthcare workers. And when we say healthcare workers, I don't just mean the nurses and the doctors and the professionals, but I'm talking about those that may be in environmental services, food service, those that may be a pharmacist tech or a nursing tech. Again, one of the things I like for people to understand is that this virus does not see diversity. It doesn't see your race, your ethnicity, your age, or anything. I know people came out saying this is going to affect the 65 years older. Much more. Yes, that's because they probably have more comorbidities, okay? Because they live longer than us.
Right.
But the fact is that we also have teenagers. I've heard a story about 20 years old and 30 years old been on ventilators. And the thing is, we're dealing with the here and now. We don't know what's going to happen after the fact, what other health conditions could emerge out of this. So we have to try to protect everyone we can to say, don't get it. That's the key. If you can avoid getting this, try not to get it. The nurses on the front line, they're my heroes. They're doing everything that they can do. I've been on the front line doing many epidemics, many outbreaks of things, and I can tell you that as a nurse, we usually come in and our focus is on that patient we're taking care of at the moment. And I have so much respect for them and so much honor for them. And I'm so proud to say that I am a nurse. Although I may not be at the bedside at this time, there were years when I was at the bedside and years when I was the leader within healthcare systems. So my hat is off to them. And I do consider nursing to be one of the best professions in the world. Regardless of what we're looking at today, I would still tell people, I'm proud to be a nurse. If I had to do it over again, I would do it again.
And we want to thank you for everything that you do and all the other nurses that are risking their lives and stuff like that. And I see that they are testing vaccines, supposedly. Now, as far as you know, is the vaccine something that everybody would be required to take? And if you don't want to take it, how does that work?
Well, I think, again, we just have to kind of go on the historical way the United States have operated. Even with just the vaccine for the children and things of that nature, we have not forced people to take vaccines. So I think it will still be up to what I will hope, though, is people will be able to weigh the risk and the benefits. Now, I know we're talking about vaccine, trying to come up with a solution. Again, I have to agree with some of the medical information I've heard recently. I think that's a ways away. So we're going to still have to do those things like the hand washing and using the mask and separating ourselves. And just because we're physically separated, the same as we're dialoguing here via the media, we don't have to be socially isolated.
Right.
So that's a difference between being able to engage and to have outreach versus saying that I'm sheltering in and I'm all alone. No, you can go out and holler at your neighbors from across the yard.
Right.
That's what our parents did. We didn't have now, okay, I'm dating myself. We didn't have telephone until I was about in the ninth grade. Okay? So, standing there on the porch and hollering across the street to my girlfriend, we made it work. Okay, so you just may have to talk to a few of us older adults. And we can tell you all how to do it, even if you don't have the technology. But you all are so blessed the technology is here. We just have to use it.
Write some letters or something, huh? Start
That's
writing
right.
up, get your pen pals.
Right.
Tell them you didn't have pen pals, Ms. Mark. Write letters. Dear John, thinking about you.
Exactly.
With masks, I just wanted to ask real quick about the mask because I know there are certain places that are saying you have to wear masks. And for nurses as well, I saw stories of like nurses having to reuse masks and things like that. What can we speak to a little bit to the safety and sanitation when it comes to the masks that we're wearing and we're purchasing and putting on every day and reusing?
Okay, I think we have to understand that there are masks that the N95 that we're talking about for healthcare workers, and so I want to just take this opportunity to say, if those masks are coming from other countries, they do need to be tested or looked at because they have different names, but they may be the same product, but they may not call them the same thing that we are calling them. So there are some that is really geared towards high infection rate. Those are the ones that we want our healthcare workers that are right there in the trenches working with those patients. And so some of protective devices and equipment has a higher rate in terms of preventing a disease. So some of the masks that we're seeing that we are sewing and people are giving out, those are just to kind of protect us. And I don't want people to think, well, if I got any kind of covering on my face or on my eyes, I am not going to get it. That's the reason why we say that you also have to be careful about hand washing. Because again, looking at the evidence, there are some surfaces that this virus can survive on for 24 hours or more. So if I come behind and just touch that and end up touching my mouth or my eyes, I could easily expose myself. So the masks are important. And one of the things I think is important about using masks as we're just out in stores, the big box stores, or walking around in our community, it makes us aware. Because we are, as people, we forget, we get busy and we just start doing things. To me, it's a reminder for me to have some caution, to be careful about what I'm doing when I'm in the stores. Yeah. What am I doing if I'm out there in the park, even if I'm just walking down my neighborhood. And this season we know is allergy season. Mm-hmm. So a lot of people can misinterpret and think that because, I have a cough, but I'll cough every spring. Yeah. My eyes are running, but this happens every spring. This is a new time. I can't just discount and say, this is my allergy cutting up, not only for my health, but for your health. So again, we're in this together and we just have to use both our best science, our best medical interventions, and then just old wisdom from way back when.
Now, Dr. Dawson, real quick, as it relates to people like, seeing signs and wanting to go get checked out. I mean, obviously no one wants to just, go mosey up to a hospital with everything that's going on because you could put yourself at risk for infection. Where is the best place to go to find testing sites specifically where either you could do like the drive up, corona test or I even heard that they're working on some at home coronavirus tests as well.
Mm-hmm. Well, one of the good things is that if people go to their state health department or even just call their local news, they can generally find out where they can do drive-through testing. That would be my first advice, is if you can do drive-through rather than trying to, please don't go to the emergency room right now. The hospital, they're just too busy. And I would tell you, most of the primary care sites are closed. So you're gonna have to go through some of those drive-through areas. Now, you may be able to get to some of your primary care physicians, but they may not necessarily have the testing. That's the other thing, is we need to expand testing. More people need to be tested. We have to get them into the Black and brown communities so that we are tested, so that we know what those results are. So one of the things that I will say to people is that if you're feeling sick, some places have numbers where you can call, which is part of the telemedicine approach. So you call, you relay your symptoms to the person, which is usually going to be an RN or some other medical person on that phone. They're going to talk to you about what symptoms are you experiencing. And then they can also direct you to places where you can go. It's very interesting because back in 2002, when I was working at a university in Kentucky, our hospital was one of the first hospitals that actually did drive-through flu testing. And that same technique is being used today by CDC to do mass testing at this time.
Pioneers. Mm-hmm. Well, Dr. Dawson, thank you so much for, spending time with us today. Can't wait till this whole thing is all over, so maybe we can meet face to face or mass to mass, whatever we're doing at the time. But, knowledge is power, man. And they say all the time, our people perish because of lack of knowledge, man. So as long as we out here trying to get the word out, man, maybe, someone will hear this and pass the word on to somebody else as well.
And thank you so much, because I hope that people are listening in your 40 cities and that they take this and spread it out. You all are doing a great work, because we can't get the word out without people such as you. So thank you so much for allowing me to come on, share and talk and have a conversation with you. And we'll continue to pray that this will soon pass.
We are the Morning Hustle.